Health Connection, medical assistance for all.
Hi to all my viewers, a very good evening. Myself Professor Dr. Harish Yadav, Prosthodontist and Implantologist from KGMC 1995 batch. I am a former Principal and Dean SGT University, Gurgaon, having teaching experience of around 25 years. Today I am going to explain to you about specialization in dentistry. This is because we have a very big myth regarding this subject in dentistry in the society. A lot of people don't know about specialization in dentistry. Most of us think that neighborhood dentist is a specialist in himself, but actually we have post-graduations and graduation as a separate course like medicine, in which we have a MBBS and thereafter we are followed by MD or MS. So we have various specialists like eye specialist, heart specialist, orthopedician, gynecologist. The same way in dentistry we have a general dentist, which is called a graduate dentist, and then we have specialization in 6 subjects, which is a postgraduate subject, and therefore we have 6 specialists, 6 clinical specialists and 3 non-clinical specialists. So in all we have 9 specialization in dentistry. All this is available in the site of Dental Council of India, which takes care of all the academics in the country. So going by the list, the first I would like to tell you is the most common pain in the teeth where we look for dentist is taken care by endodontist. Root canal treatment, we have commonly heard, is a very popular treatment these days. The specialist for this treatment is called as an endodontist, and that doctor specializes in the subject by studying for 3 years after the graduation to exclusively take care of this root canal treatment. Thereafter, the second most common specialization is prosthodontics. Prosthodontist is a specialist who is trained to replace all the missing teeth in the mouth by either dentures, fixed teeth, crowns and bridges. Then we have periodontist. Periodontist is a specialist for gum disease. This specialist takes care of all the problems related to gum, pyorrhea as we commonly call it, bleeding gums, flap surgery, curettage and cosmetic gum treatment and such related things. Thereafter we have orthodontist. Orthodontist is a specialist who is treating teeth for all the braces treatment. Malaligned teeth, most of us think of having braces only because of cosmetic reasons, but that is not true. In fact, many of us need such treatment because we have teeth which do not have good occlusion. They need to have braces done in order to avoid any permanent damage to the teeth in long run in life. So it is advisable to have braces consultation at around 10 to 15 years in life, all of us, without having any problem. So orthodontist is a specialist who takes care of all the such job which involves braces, which can be right now visible, invisible, and there are various types. Then there is lastly the clinical specialization is pedodontist. Like we have a pediatrician in medicine who is a specialist for treating children, so we have a pedodontist which has the specialization to treat the teeth of younger children up to 12 years of age. So most of us think that milk teeth are to fall, and so they do not need treatment, but it's not like that. Science has a separate specialization for children. All the milk teeth need to be taken care of till they fall off, so that the permanent teeth below them should come in right place and should not get infected or discolored or distorted. Thereafter we have 3 more non-clinical specialization, but And they are basically oral pathologist, community dentist, and oral medicine specialist. And oral medicine specialist usually is actually not a non-clinical, is also a clinical specialist, but usually a doctor on call for problems of like cancer and rare diseases of mouth. They can be called as the dental physicians. And last but not the least is a new coming specialization, which is called as implantologist. In India, there is no separate post-graduation degree for implantologist, but three specialists, namely prosthodontist, periodontist and oral surgeon, they combine to deliver this work, but all of three are the specialists trained, and they can all do this work as a matter of the guidelines from Dental Council of India.
Medical disclaimer: the information in this video is not intended or implied to be a substitute for professional medical advice, diagnosis or treatment. All content, including text, graphics, images, and information, contained on or available through this video is for general information purposes only. It is not intended as medical advice, and should not be relied upon as a substitute for consultations with qualified health professionals who are familiar with your individual medical needs. The whole sole purpose of this video is to make people aware of healthcare and medical knowledge and developments. We at Health Connection specially recommend you to visit an authorized physician nearby for medical opinion, medication, treatments or procedures. For more details, kindly visit our website www.healthconnection.in, or if you have any questions, comments or concerns, please do not hesitate to write to us at info@healthconnection.in.